Hey, good morning, everybody, or good afternoon, everyone. This is Tuesday Talk with the Doc for April 7th. I'm losing track of days. Anyway, there's a couple things I wanted to talk about, and I just got off a really great webinar with my alma mater, the Arizona Center for Integrative Medicine, and sorry, it's actually now called the Andrew Weil Center for Integrative Medicine. So a lot of you have heard of Dr. Weil. He's fabulous. Along with everybody there, Victoria Mazes, Lisa Altschuler, Randy Horowitz, Anne-Marie Chasson, and a woman who presented some really great stuff on healthy spaces. So what I'm doing is kind of giving you some of the information from their webinar, but it was really long, so we're going to break it up into pieces. So today, I want to just talk a little bit about COVID-19 and this specific coronavirus. And you guys know I'm a nerd, right? So there's some science and pictures that you probably will not be able to see well, and that's fine, because I want you to get the big picture about the virus. And then we're going to talk about some supplements and some caveats on supplements for COVID-19, because really, we don't have studies on the supplements for this virus. We just don't have them. They haven't really happened. So moving right along, if I know how to work my system, this is great. I love it. Oh, I know what I have to do. There we go. Okay, so this should make it happen, I hope. There we go. So here's the COVID virus. Oh, sorry. So it's a coronavirus, and I think some of you have heard about this already because it has a spike proteins coming out of it. You know, it's got like its little crown, little corona. And this quote from 1977 by biologist Jean and Peter Medawar, it's just like, a virus is simply a piece of bad news wrapped in a protein. Yay. So the coronavirus has an oily lipid membrane, and you can't see my pointer. Okay, so the kind of orange where the red is sticking through is that lipid membrane, a fat membrane. It's a pretty large virus. It's moderate to highly infectious, and that's what we're seeing. It's fairly virulent, moderately virulent, and its goal, the goal of a virus, kind of like rabbits, the goal of a virus is to reproduce and reproduce and reproduce and reproduce. Its envelope, or that oily lipid membrane around it, is its Achilles heel. And, you know, we often try to treat viruses with vaccines and antivirals. We don't have specific ones for this virus yet because it's a novel or a new virus. It's not a virus in a book, not that kind of novel, but novel meaning new. So the stages of COVID infection, there's pre-infection. So that's like our prophylaxis and our preventive stage, right? And then there's infection and pulmonary disease complications. And you've heard this term ARDS, and that means acute respiratory syndrome. You've also probably heard cytokine storm. So cytokine means cell movement, but what we really think of cytokines as cellular messengers. So we can have good cytokines that are helpful for us, and we can have bad cytokines, or they can be a mix, or sometimes they're good, but if we have too many of them, they're bad. So, and then what happens in the cytokine storm is this lovely long phrase, secondary hemophagocytic lymphohistiocytosis. Really what that means is badness, and they're abbreviating it SHLH. But all you need to know, or all you've probably heard, is cytokine storm. You don't need to know secondary hemophagocytic lymphohistiocytosis. So let's talk about this prophylaxis prevention. And this is what we've been doing. This is what the stay-at-home order, the 6 to 10 feet away from everybody else, is the masks. That's what all of that is meant to be for, is to limit our exposure, to slow the spread so we do not overload our hospitals, urgent cares, ERs, ventilator capacity. So yeah, limiting your exposure is fabulous, but maintaining a healthy immune system, because as the first slide said, let me go back to the first, if you'll let me, a healthy organism resists infection. I want you guys to be healthy organisms. So how do we do that? We do that with healthy sleep, good nutrition, lowering our stress, and potentially with select supplements. So this is kind of what we're going to talk about today. We'll go into more detail on other aspects of things we can do in future webinars. So stay tuned. So sleep, you know, we hear about the 8 hours of sleep. Everyone has a little different sleep cycle, so their optimum hours of sleep is a little bit different, but we can say, you know, 6.5 to 9, and most people fall in that 7.5 to 8 kind of range. So sleep is super important. And what impacts sleep? Well, anxiety can impact our sleep. Worrying can impact our sleep. So lowering our stress helps our sleep. Good nutrition. I still find it sadly humorous that at the grocery stores, especially in the beginning when I think there was more urgency to stock up on things, mostly vegetables were left. And not just any vegetable. Dark green leafy vegetables were left. You could find beautiful rainbow chard and other dark green leafy things, kale, even spinach. You could find those. You couldn't find maybe a piece of meat to save your life or toilet paper, but you could find dark green leafy vegetables, which is one of the things we really need to be eating a lot of because of their bioflavonoids, and which just means they're really colorful and have great plant chemicals that help us, bioflavonoids. We can eat some of the things we need, and we should be. So let's pick some of those up. Okay, so moving on. This is ugly. I admit it. The things in red on this picture are possible pharmaceuticals to combat the virus, possible treatments, not treatments. So don't get caught up in all the drugs yet. They are possible, they are not proven. But we know about this infection. It binds to the cell receptor ACE2. There's a lot of talk about ACE inhibitors and how those play with each other. That's a whole other conversation. And there's actually a really great video on MEDCRAM, MEDCRAM, and that's on YouTube. And I totally forget the physician's name, but he does some really great explanations of complicated things. And one is on the ACE2 receptor. But it binds to that receptor and sneaks inside the cell. So the virus is out here, the cell's over here. It binds, and then the virus sneaks inside the cell and uses its nucleic acid, its RNA, to hijack the cell's mechanism, and then makes new little virions, inside that cell, and then the cell bursts and releases mature virus. So it gets in there, hijacks, and makes a large amount more. So gross oversimplification of this complicated picture. And then what we know happens is acute respiratory syndrome and the cytokine storm. So when this virus infects the cells of our upper respiratory system, we have a couple different cells in there. It releases all these new viruses. We get a cough. If your immune system is good, you may clear that in a while. It'll take a while to clear that. If your immune system is not good, if you have a pre-existing lung condition or pre-existing condition that affects your immune system, it can travel to your lower respiratory system. So when that happens, a lot of things can happen, and your lungs can fill with fluid. You can compromise your little capillaries to your beautiful, respiratory sacs. There's a much better name for that, but you can compromise your lungs, and this cytokine storm puts everything in overdrive. And that can happen, as we have seen, very, very quickly. So I'm going to tell you one thing to see how your lungs are doing. If you are worried about this, and this is a great little test, you can do it in the morning, in the evening, twice a day, 3 times. I don't care, because breathing is good. So it's very simple. Hold your breath. Can you hold it for 15, 20 seconds? Most people can. We just don't test that very often. But take a deep breath and hold your breath for 20 seconds. I'm not going to hold it that long now because it would be really boring for you. Our phones, all our phones have little timers on them. You know, you can watch a clock if you still have a clock with a second hand, but about 20 seconds. If you can still do that, your lungs are in pretty good shape. We don't always notice damage to our lungs, and that's why people are arriving at the hospital and getting intubated very quickly, because we haven't noticed things are going on in there. Because our lungs are fabulous organs. They can take a lot and still keep us going until they hit that tipping point. So it's a simple thing of taking a deep breath, holding it for 15, 20 seconds, or as long as you normally can without difficulty, is a simple, free, easy test to see if your lungs are still okay. If you can't do that, call your medical provider and go, hey, I've noticed this. And they'll help you through the next things. So therapeutic considerations, and why are we making multiple recommendations? Because, and which can be confusing, and I'm not gonna lie, there are lots of recommendations out there on the web, in person, everywhere. There, you know, you Google recommendations for COVID and it's an avalanche of things you can get. But why are we making these recommendations? Because we want to prevent the infection. We want to stop the virus from replicating or spreading in your body. We want to prevent the cytokine storm without inhibiting your own body's antiviral immunity power. And we want to hasten recovery. Most people, over 90% of people recover. Most people recover. So keep that in the back of your mind. So let's talk about some dietary supplements. And this is really important because no integrative measures, no supplements have been validated in human trials as effective specifically for COVID-19. None. Okay? Nothing. The strategies I'm presenting here are based largely on preclinical evidence, which means non-human evidence. Clinical evidence means, or a clinical study means it was done in humans. Preclinical means it was done in other animals, and are supplemental to current public health measures and conventional treatments. These are not standalone. This is integrative medicine. We put things together. So public health, current practices in conventional medicine, supplements, wellness strategies, integrative medicine, not alternative. And we always look at the risk versus the benefit. Given how little definitive information there is regarding COVID-19, it is important to evaluate any intervention from a potential benefit and possible risk. This includes our pharmaceuticals as well. We know things like Plaquenil or hydroxychloroquine, I think Fauci may have said this, someone else may, but it has a very narrow window of benefit, which means if you have too much, it's toxic. If you don't have enough, it's not doing anything. So everything we look at, integrative, traditional, Western, Eastern, whatever, we look at the risk versus benefit. So these are kind of our 4 categories. It's highly likely, but it may have some risk. It's not likely to be beneficial, and it has a lot of risk. We stay away from that 100%. Low likely benefit, low possible risk. We probably don't use a lot of that either. We like the high likely benefit and low possible risk. I mean, you like that for everything, right? Even our outdoor activities. You know, you got your mountain biking, you got your downhill skiing, you got cross country skiing, you got hiking, trail running, walking, swimming. Now, I personally don't do hardcore mountain biking because my likely benefit in no way outweighs my possible risk because I'm not that coordinated. So I have a high possible risk and maybe a moderate likely benefit, but that high possible risk rules mountain biking out for me. Now riding my bike on the river trail, I'm pretty cool with that. So just an example. So we look at things like this because we want the high likely benefit and little to no possible risk. So this is very complicated. We're not going to spend a lot of time here. If you want to learn more about this, we can revisit this at a future webinar or give us a call and I can talk about it. But we're really trying to, there's 3 components of prevention. Block the virus from attaching to that receptor, the ACE2 receptor. Prevent entry by inhibiting what's called cellular proteases. Increase innate immunity and decrease inflammasome activation. Big words. So block viral entry. So we'll talk a little bit more about this and what supplements might have some or have shown in other animals, often rats, sorry, to be helpful. So preventing the injury, or I'm sorry, preventing the attachment to the ACE2 receptor. Astragalus, which is a Chinese medicinal herb, I've used it for decades. It's one of my favorite. It is a fabulous plant and root that we use. And astragalus extract has been shown in rats to decrease ACE receptor activity, potentially beneficial. Quercetin, now we talk a lot about quercetin. I take supplements that have quercetin in them every day, whether or not there's a pandemic. It's one of my standbys. And if you're on the Vitality stack or the Ultimate stack, you are getting some quercetin. And if you want to know more about those, again, contact us. But quercetin has been shown to bind the ACE2 receptor. So it's in the way. So if it's bound to the quercetin, nothing else can bind that. So it blocks it. Vitamin D, D3, also has been shown to reduce ACE2 activation. And really, most people are vitamin D deficient. So taking some vitamin D is an excellent place to start. How much vitamin D should you take? Well, you don't want to be deficient, but you don't want to be too high. So there's a sweet zone in there. And to really figure that out, we should test your vitamin D. Easy test, not that expensive. Available everywhere. And yeah, the lab drawing facilities are still open. And we can send a lab test very easily, very inexpensively, if you want to know your vitamin D. Preventing or reducing viral replication. So you've heard a lot about zinc, probably, like zinc lozenges were like gone. Everyone like bought them all up and they were gone. We have some here. We have a couple zinc formulas here if you need them. They're also available on our online store, which is mimicares.square.site. But zinc potently inhibits the enzymatic activity of SARS-CoV-2, which is COVID. COVID-19 has several names depending on what you're looking at. So it potently inhibits the viral protease, which is necessary for viral replication. So fabulous. And chelators of zinc, zinc ionophores, increase the transport of zinc into the cytoplasm. So quercetin is one of those. You don't have to take a quercetin supplement. You don't have to take the supplements I take. I just love them, but you know, everyone's different. You can eat onions and apples and get quercetin. Apples and onions are both a fabulous source of quercetin, as is green tea, EGCG, or epigallocatechin gallate. Yeah, so just say green tea. Green tea is great. Everyone should be drinking at least 3 cups of green tea a day. So you can eat your sources for these zinc ionospheres, for quercetin. Again, what's been left in the stores? Vegetables and fruits. So a little bit more about vitamin D. So vitamin D activates innate immune cells and induces a bunch of other stuff, including an antiviral peptide. So if you've heard me talk before, you know I love peptides. But it can induce an antiviral peptide. It activates innate immune cells. When we're in a good zone, you can get too much vitamin D. It is a fat-soluble vitamin, so we don't eliminate it like we do a water-soluble vitamin. So you can get too much. And excessive intake can sustain an inflammatory and potentially damaging response. So you want to be in the sweet zone. And we can talk more about the sweet zone individually if you have questions on vitamin D. So this is a lot of big, long words. Let's just say in the initial infection, you have this inflammasome activation. So inflammasome, so an inflammatory bag of stuff in your body. In SARS-CoV-2 or COVID-19, excessive activation and excessive cytokine release, that cytokine storm, is what happens. So you get this hyperinflammatory state leading to the ARDS. So we want to calm that storm and reduce NLRP3 inflammasome activation. You don't have to remember any of those names, but we want to reduce that cytokine storm and how it's activated. Yeah, let's go to the next slide. So, because this is what you want to know, right? What potentially may help? Vitamin C reduces NLRP3 inflammasome activation. So it can help halt that process. It can shorten frequency, duration, and severity of the common cold and pneumonia. So that was a systematic review of human clinical trials. The references are in the bottom of the slides. So not studied with COVID-19. Let's be very clear about that. Not studied in that, studied in the common cold and pneumonia. Is it transferable information? We have no study to confirm that. Melatonin has been found to inhibit NF-kappa B and the same NLRP3 inflammasome as well. We have also found in other studies that it reduces oxidative lung injury and inflammatory cell recruitment during viral infections. Other viral infections, not COVID-19, those studies have not been done. But very interesting. So reducing this activation can also happen with what I said before, plant flavonoids. Of course, you can buy them in a supplement form, but you can also eat all those vegetables that are, especially those dark green leafy ones that are left in the supermarket that nobody seems to be eating. Quercetin, yes, you can take a supplement, but you can also eat more onions and apples and garlic too. Because there's garlic. The organosulfur compounds in garlic has also been shown to be beneficial in our immune response, and specifically suppressing inflammatory cytokines IL-6, TNF-alpha-3. And I'm Italian. Who doesn't love garlic? I mean, some days I smell like garlic all day long, but I think that's a good thing. So you can eat a lot of these things. And again, green tea. So, and people are leaving these on the shelves. So they're available and they're yummy, and we're probably cooking a lot more at home these days. So experiment. If you haven't cooked with garlic or with mini onions, or, you know, add apples to things. It's, it can be fun. You can make it fun. And curcumin. So curcumin is turmeric. So maybe between Jill and I, we can put some turmeric recipes up on our Facebook page, because turmeric is fabulous. And you can make this really yummy cashew milk, golden milk turmeric beverage that is heaven. And Dr. Tarone Lodog, she loves this, and I have a recipe, so maybe we can share that. But curcumin, and I take this every day. It's in one of my supplements, one of my activators I take every single day, and it's fabulous. It reduces viral attachment, entry, and replication, as well as activation. So it's like hitting all those things we want to stop. It is an anti-inflammatory molecule. It helps suppress cytokines involved in the cytokine storm. Fabulous. It also inhibits the inflammasome while inhibiting coronavirus replication through viral protease inhibition. And this was, reference number 7 didn't make the page, but reference number 6 is on there for coronavirus. Now, I want to be very clear, that's not necessarily COVID-19. There are multiple coronaviruses. The study was probably done on a different coronavirus, not COVID-19. Oh, and then medicinal mushrooms. Like you guys know, I love mushrooms. We grew mushrooms last fall. That was a fabulous activity, but I am very, very hot on the mushroom thing. And I don't mean psychedelic mushrooms. I mean medicinal mushrooms. So we talk about the fruiting body, which is what we always see, like that's what we eat. A mushroom is the fruiting body of the mushroom, and the mycelium, which is sort of like its roots, because they don't have true roots. They have these other little fingerling things. Anyway, medicinal mushrooms, especially of Agaricus blazei, I almost said that wrong, activate our innate immune response and increase interferon production, and has anti-inflammatory actions. It's just, mushrooms are fabulous. So not just Agaricus blazei, but Agaricus, cordyceps, enotaki, which some of you may have eaten, especially in Japanese food, amado, agekon, reishi. Some of you have had reishi mushrooms, maitake maybe even, lion's mane. We grew those, or I tried to grow those last fall. I didn't have the best luck with my lion's mane. Chaga, which is kind of an ugly mushroom, but is so fabulous for our immune system. Shiitake, I'm sure you guys have eaten shiitake mushrooms. Mishima, birch, polypore, pearl oysters. I know there's a woman whose name has left my head in town who had these fabulous pink pearl oysters last year. They're gorgeous and very yummy. Split gill polypore mushrooms and turkey tails. Turkey tails have gotten, maybe people have heard of those for other medical problems. But the color on the mushroom looks like a turkey tail. That's where it gets its name. But like every day now, I'm taking my Stamit 7 form. It has 7 of these in it to just boost my immune system a little more. And I actually use the mushroom powder because I can put it in shakes, I can put it in smoothies and juices, whatever, soup. And I know some people don't like mushrooms. You can't taste it. I can hardly taste it when I just put it in water. So it's easy, and it's a great immune booster in general. Has it been studied in COVID-19? No, it has not. But trying to reduce this inflammasome activation in the cytokine storm, we've seen it in other things. And there's some references there for you. So in summary, we have no clinical trials documenting the effectiveness of various dietary supplements in the prevention, management, treatment, mitigation of SARS-CoV-2 or COVID-19 infection. We have no clinical trials documenting that effectiveness. However, there's a substantial body of preclinical research, non-human research on selected supplements which indicate possible benefit and low to no risk of harm. Many of these things we talked about, they're foods we eat often, or I'll say humans eat often. So the risk of harm is very, very low. Of course, if you have an allergy to one of them, do not take it. These strategies are not a substitute for our public health measures of physical distancing, hand washing, avoidance of touching the face. And whenever you watch me on a webinar or Facebook Live, you know that's one of my issues. I'm really bad at not touching my face. And I'm trying to be better at that. Furthermore, it is imperative to seek medical care for fever, cough, difficulty breathing. If you need to contact a provider and maybe your provider's office is no longer open or not taking calls or not doing telemedicine, feel free to call us. If we think you need more than what we can provide, we will do that. We will refer you to wherever you need to go. And do that simple thing of seeing if you can hold your breath for 15 to 20 seconds. It's super easy. And do everything you would do, you know, in the past when you had a fever and cough. Do not take ibuprofen. Let your fever be expressed. Your body's creating a fever for a reason. Obviously, if it gets very high, that's too high. And we need to try and bring that down. But some of the common things we take for fever, like Advil, ibuprofen, are really not recommended in COVID-19. But keeping a fever of even around 101 can be helpful for our body to fight the virus, or any virus for that matter. And it is, of course, advisable to consult with a knowledgeable integrative practitioner before starting any new dietary supplement. So supplements, and a lot of the ones we talked about are food, but they can interact with maybe other medications you're on, or you may have an allergy to them, or, you know, there's various things. So we always recommend you consult with a knowledgeable practitioner. It doesn't have to be me. There are others in the Valley. There's others in Colorado and Utah and, well, everywhere, right? So it doesn't have to be me, but please consult with somebody before you start and have a plan for your supplements. You do not need to be taking 20 different things, especially if you're on other medications. So let somebody help guide you to what makes the most sense for you. I want to thank the University of Arizona and the Andrew Weil Center for Integrative Medicine. And please visit this website, awcim.arizona.edu/COVID-19. It's a fabulous resource page with some great information. It has an FAQ section, frequently asked questions section on supplements and vitamin D and different things. So it's a really, really excellent resource they've put together. Access to it is totally free. And they will post the full webinar. I believe they're going to post a full webinar in a few days, accessible from that page too. So you can hear more of the nitty gritty of what they talked about if you so desire. Oh, sorry, I thought there was another slide in there and not that one. I also want to mention 2 sites, and let me see if I can find them for you, because these were some really good resources as well. Stand by one moment here. I think, there we go. I just put it in the wrong place. So the University of Arizona, obviously because of the arizona.edu, also has the My Wellness Coach app. It is free. You might want to check that out. And then you've heard me talk about the wholelifechallenge.com. They are doing a 12-week program that starts April 11th, so 4/11, and we will have a team for that as well. So Team Mimi, because I'm so creative with names, check that out as well. Both of these are really, you know, about stress reduction, nutrition, movement, having social interaction, and you know, keeping you engaged in your own wellness, and in an online community that is focused on our wellness and giving us all kinds of online education and support. So I think they're both absolutely fabulous resources. And then this is us. We're Mimi's Clinic at the Marchionda Imaginative Medicine Institute. I'm Dr. Marchionda, Dr. Paula, most people call me. And I am a physician. I'm an MD. I used to be a nurse, and once a nurse, always a nurse. So you know how that goes. My MPH is a master's in public health. So I've worked in public health as well. You can reach us at mimi@mimicares.com. Give us a call at the office if you need us, 970-628-1624. And then our website is mimicares.com. There's more resources on there. I'll also post this webinar on our YouTube channel. Might take me a little while to do that. Give me a couple days. I'll do it as soon as I can. And you can always contact us through the website, and our online store is mimicares.square, SQUARE, .site, SITE. Sorry, I didn't put that on the slide. Probably could right now, huh? Yeah, I guess I can. So it's mimicares.square.site for our online store. And I will admit, our online store is a little clunky. If you're having issues, just give us a jingle, give us an email, and we'll help sort you out. We are doing some deliveries of products. If you need them, you can call us an order or order through the store, and we will coordinate that with you. We have pickup at the clinic. I almost touched my nose. The clinic is otherwise having very restricted hours, and I am monitoring, scheduling and seeing folks who absolutely need to be seen in person or for a procedure. I'm staggering them so there's plenty of time in between for us to clean in between visits. We will also be starting antibody testing for COVID-19, hopefully early next week. And we'll have more information on that, and I'll do a webinar on that as well, probably next Tuesday. And we'll do more information from the Weill Center for Integrative Medicine, because it was a really fabulous presentation earlier this morning. Otherwise, you need anything, let us know. We're here to help. Or if you know somebody who needs help, let us know. Because what I find this is doing is bringing us together as a community, and I think that is fabulous. And the resources we have on the Western Slope are amazing, and people want to help. We have volunteers who want to help, so let us know if you need anything. Alrighty, we'll see you next week and on Facebook Lives later this week. Ciao, have a great day.